extension, flexion and extension. So the sagittal plane divides the body into right half and left half. No?
Yeah.
And the movement that occurs along that plane are
Flexion and extension.
flexion and extension. There's another plane of the body that divides the body into frontal, ventral, and dorsal part, or anterior or posterior part of the body. Divides the body like this, into anterior and posterior part. That plane is named the coronal or the frontal plane. No? And the movements that go along this plane are abduction and adduction. Those are the body. No? So the plane that divides the body right on the half is the sagittal plane. The movements that go along with it is are flexion and extension. There's another plane that divides the body into anterior and posterior part in the center. And the movement that goes along that plane are abduction and adduction. And we also have another plane that divides the body into superior and inferior parts, which is the name? The transfer plane. And what movement occurs along that plane? Rotation movement. The conduction is the sum of all the movement put together, adduction, this and that, blah, blah, blah. Okay, we did a little bit of that. The bones, you know the bones a little bit?
A little bit.
So this one here would be the frontal bone. The nasal. The vomer, V-O-M-E-R, vomer. Huh? The maxilla is one, maxilla. This one, the mandible, clavicle, ribs. How many ribs we have?
A lot.
12 on each side. How many are true ribs?
8.
7? 7 true ribs. Why true ribs?
Because they're actually.
Because they attach to the sternum. They're 1, 2, 3, 4, 5, 6, 7. Okay, 7 true ribs. And how many false ribs?
5.
1, 2, 3. 3 false.
3 on each
The 3, why 3 false? Because these 3 arise from this one here, from that 7. No? And how many floating?
2.
And 2 floating ribs. No? Okay, what are these? What is this?
The cervical spine.
Cervical vertebrae, cervical spine, cervical vertebrae. And these vertebrae that go transversely across, like this. How do you call those?
Transverse process.
The transverse processes. The transverse processes, no? They go transversely across. And the ones that are sticking out?
The spinous process.
The spinous processes. How many cervical vertebrae? 7. 7 cervical vertebrae.
5 lumbar.
Respiration has to do with which? 3, 4, 5, 6, 3, 4, 5. Okay, what is this?
The scapula.
Scapula. What is this here?
Spine of the scapula.
The spine of the scapula. What is this here?
I don't know that one.
Person.
A supraspinous fossa. Supraspinous fossa. Why supraspinous? What does that name tell you?
It's above the spine of the scapula.
Supraspinous fossa. What is a fossa? What is a fossa? An indentation, a shallow depression. A shallow depression. So this would be the supraspinous fossa. Why supraspinous fossa? What does that name tell you?
It's above the spine of the scapula.
Superior, superior to the spine of scapula, the scapula, no? Supraspinous fossa. What muscle are you going to put there in the supraspinous fossa?
The supraspinatus.
The supraspinatus. We're going to put the supraspinatus there. And this here, how do you call this one? This?
The infraspinatus.
Infraspinous.
The infraspinous fossa. What is a fossa?
It's an indentation.
An indentation, a shallow depression. What muscle are you going to put there in the infraspinous fossa? Huh? Infraspinatus. The infraspinatus. So in the supraspinal fossa, we're going to put the supraspinatus. In the infraspinous fossa, we're going to put the infraspinatus. How about this fossa here? The what? What?
Subspinous fossa.
Huh?
Subspinous
Subscapular.
Subscapular.
The
sorry.
subscapular fossa.
Subscapular.
The subscapular fossa. What muscle are you going to put in the subscapular fossa?
Subscapularis.
The subscapularis. What one is this here?
The humerus.
Humors.
The humerus. It's a little crooked, but that's okay.
Yeah, it's good. Crooked.
Somebody did something to Seymour. What is this one here? The sternum.
Sternum.
The sternum. The sternum. This top part of the sternum is?
The isn't the acromion?
Huh?
The acromion.
Manubrium. The acromion is right here. If you want to change it here, you're going to have a problem, Seymour. So it's the acromion. I mean, don't get me confused. I'm not a real yet.
Manubrium.
So the manubrium. And this is the body of the sternum, no? The whole thing is the sternum. And this here, the xiphoid process. The xiphoid process. Now,
Clavicle.
the clavicle, this clavicle is a little too high. It should be here, articulated with the sternum, with the part of the manubrium. There is a joint here in between the sternum and the clavicle. How do you call that joint?
Sternoclavicular.
The sternoclavicular joint. And there is another joint here. What is this part here? The acromion. There's another joint here between the clavicle and the acromion. How would you call that? The acromioclavicular joint. We know that this is the
Scapula.
scapula. This is
The medial border of the
the
scapula.
medial border of the scapula. The lateral border of the scapula.
Inferior angle.
Inferior angle. Welcome, Logan.
Yeah, we got
Superior
it.
angle.
Superior angle.
Spine of the, or no, supraspinatus fossa. Supraspinatus fossa.
Supraspinous fossa. And this here,
The glenohumeral fossa.
the glenoid fossa, or the glenoid cavity, and the joint is
Glenohumeral joint.
the glenohumeral joint. This is, we said, the humerus. What do we have here? The head of the humerus that articulates with
Glenoid fossa.
the glenoid fossa, or the glenoid cavity. What do we have here that the deltoid is attached there?
The deltoid
The
tuberosity
deltoid tuberosity. This is what?
is the
The medial what? Epi what?
epicondyle.
Epicondyle. What is a condyle?
Protrusion.
A protrusion, and then something on top of it. Epi on top of. What is the bone that goes here?
The
Radius.
The radius. The other one here. The ulna. What are these?
Carpals.
The carpals. This. Metacarpals. What is meta? Beyond, bigger, meta, big. And these are
The phalanges.
phalanges. This one here is the
Yeah, we didn't get that far yet.
oh, the proximal medial distal. Proximal phalange. Proximal phalange. This one. Close the door, please.
Morning.
Thank you.
Proximal.
Proximal phalange.
Medial. Distal.
This is
Distal phalange. What do we have here?
the pelvis.
The pelvis. What is the top part of the pelvis?
The
Ilium.
The ilium. What is this part here?
The
The all the muscles attached there, and you should cover that.
ASIs.
No.
No, that's the
Oh.
is that the ilius?
Tuber what? Start with tuber. From the Latin tuber, T-U-B-E-R, which means swelling. Tuber something, look for it. Tuberosity. What is this here?
The acetabulum.
The acetabulum. This one is the glenoid fossa, this is the acetabulum. Which part of the, which one is this?
Femur.
Femur.
The femur. And this is
Head of the femur.
the head of the femur. This,
The neck of the femur.
the neck. The head, the neck. This here,
The greater tuberosity.
greater trochanter. The greater trochanter. This one here,
So lesser trochanter.
the lesser trochanter.
Medial epicondyle.
Media and
Lateral epicondyle.
lateral. What one is this one here?
That is
Tibia.
the tibia.
The tibia,
Fibula.
the fibula.
The
calcaneus,
Talus.
talus,
The talus. So the talus rests with the calcaneus, no? And this is the tacon tali. I don't know if you remember. Oh, okay, these are the
tarsals.
tarsals.
Metatarsals.
This is the,
calcium,
huh?
Cuneiform.
cuneiform,
Yeah, it's a cube-shaped bone. The cuboid. The cuboid. This here is from Latin navicular, which means like a bow-shaped. No? Navicular. These are
The
cuneiform from the Latin cun, which means wedge,
Yeah.
like wedges. So this is cuneiform 1, 2, and 3. This one is the medial cuneiform,
Yeah.
the middle cuneiform,
It's just the middle. Yeah.
The middle.
and the lateral cuniform.
Medial, middle,
And these are
The
Metatarsals.
metatarsals.
metatarsal. What is meta?
Beyond.
beyond,
Beyond, larger. And these are, of course,
Phalanges.
phalanges,
phalanges. Proximal, medial,
Distal.
distal,
and distal. Mhm. These are the, of course,
Cervical vertebrae.
cervical vertebrae. These are the
The
Transverse
transverse
transverse processes. These are the
processes.
spinous processes. So how many vertebrae, cervical?
7.
7. And these are
The thoracic.
thoracic. How many thoracic?
12.
12,
12. How many lumbar?
5.
5,
How many sacral?
5 fused together.
Okay. And
The coccyx.
the coccyx.